let me give a little bit of introduction about myself, and after that, maybe I will we'll start learning. I'll focus today on data analytics part, but yeah, some of you have requested about learning on lean as well. So I will. Last time, actually, I did cover lean. This program I keep doing often, and today I have got a throat infection. So yeah, a little bit of energy is a little down. So, but I'll try to. I'll try to act as if I'm energetic. Sometimes you have to do that, right? Okay, and as healthcare professionals are expert in doing that. So, welcome to CPHQ introduction training and CHQ certification. So, if you don't want to appear for the CPHQ exam, a lot of people they say that we have learned lots of stuff in healthcare quality, but we don't want to write a CPHQ exam, or maybe we don't want to write it now. Maybe we'll write it later on. Then, if you just attend the full CPHQ preparation course, you get a CHQE certification from Anexas. So that is also something which you can carry with you if you attend our full-fledged course. Okay, so I'll start with what is CPHQ, and then what are the benefits, and what are the modules. Then we'll jump to the healthcare data analytics. And as I told you, some of you wanted me to cover the lean. So lean also very quickly, I'll cover today lean. Then after that, we'll start learning about lots of tools and techniques related to data analytics. And I'll not cover today too much about patient safety. And we'll try to give some examples, some improvement projects examples from the healthcare if possible. And then we'll have some discussions. Regarding the organizations, we have been doing training programs since 2006 and trained more than 150,000 people, more than 1,500 certified professionals in healthcare quality, CPHQ. So, in fact, we have lost the count. It is much, much more than that. But yeah, last we counted was 1,500. And it's quite a big number. Total certified professionals in whole world, they are around 15,000. And the people who appear for exam, who conduct the training from us, who appear for the exam, they're going by our record. Whoever has appeared for the exam, they have always passed. Some people, earlier they have appeared and without our training, maybe they did it, somewhere else. And when they fail, when they attend our trainings, they pass. And a lot of people keep telling us like that. So anyway, we have trained worldwide, some photographs to prove that I have conducted training programs worldwide. So if you are joining the CPHQ session, you will be joining my session. So I also conduct Lean Six Sigma, PMP, CPHQ, AI, and data science programs. So that is my forte. And CPHQ I have been conducting for the last, I think now 11 or 12 years. And every year, lots and lots of people, more than 100 people have passed. And we are always happy to tell those numbers. So this is China. So right from China to Saudi Arabia, Australia, to US, we have done training programs. People from US, they attend our training programs online as well. We have won many awards and various forums, Hospital Management Asia for the 10 years continuously. I was a speaker, and three times I was a keynote speaker as well. Then, I've also done a lot of work in healthcare in Lean and Six Sigma implementation. And this is one, let me show you one video. One of the certified black belt from us who has completed a project in National Healthcare Service in UK. He's talking about his project.
Well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvements at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
So being a CPHQ professional is just not, talking about quality or doing an improvement project, but also saving a lot of money. And we have done these Lean Six Sigma projects in various hospitals, and a lot of CPHQ.
Mr. Andrew Robertson with us.
Anyway, we've got a lot of
King Edward VII Hospital in London, and
a lot of videos, but maybe quickly, if I also those who are from Indian subcontinent, they might
I am Shekhar
know
Suman,
about
and I wish to
Steve
congratulate
business
all the
TV
Six
show.
Sigma certified.
He is a very popular TV show host where I have presented lots of process excellence, 13 episodes of process excellence related topics and programs. Quality American. On 21st of May, I have got 30 years of experience, 33 years rather, as well. Note maybe I will just lots of in Iran as well. We have got lots of projects, lots of work we have done, improvement projects, quality related projects. So we are not only teaching, we are also actually implementing whatever we are preaching. So being a CPHQ is not only just passing an exam. You have to also implement that knowledge. Obviously, in the exam, you will not be tested on implementation part. Means, if you know the implementation part, you can pass the examination. But after you are a CPHQ, it is expected that you bring in some positive change in your institute or your organization or your medical college or hospital or a clinic or a lab. Okay, so it is very prestigious, CPHQ. I'll not talk too much about it because most of you are already aware of it. I'm not, I'll just quickly pass that part, But it will be a good idea. Some of you might be interested in knowing how many chapters are there. So there are 7 lessons. And when you join our training program, you can you will learn each and every chapter in detail with a lot of examples and practice questions so that you pass the examination. But for the time being, I'll just give you a brief overview, and we'll choose 2 or 3 or 4 very difficult topics from CPHQ and the learning course, and then we will elaborate on that. So first lesson is about the quality, leadership, and integration. It's about creating a strategic planning. As a healthcare quality professional, you should be able to advise the leadership on organizational improvement opportunities. How are the best improvements done? They are done by converting the improvement opportunities into projects. So what you do as a quality professional, you convert the improvement opportunities into project. And what is the definition of a project? The basic definition of a project is that it is a starting point and it is an end point. It doesn't end after some time. So you help the leadership choose multiple projects, assist with the development of action plans, and then assist with the establishing priorities, which project should be done first, which improvements should be done first. That's how you assist them. And then engage the stakeholders, all the employees, all the people, all the managers, the definition of a stakeholder is that any person who is positively or negatively impacted by your improvement project is a stakeholder. So engage those stakeholders. And that's what this chapter talks about. Then we also, moving on to the second chapter, performance and process improvement. Now here you will learn a lot of tools and techniques like Lean, PDSA, Six Sigma, Fishbone diagram, FMEA, process map. And in fact, Anexas as a company is well known for delivering great quality training programs and statistical tools and techniques. So those who attend our program, they never fail CPHQ. One of the reasons is because around 67% of the questions are related to data analytics and process improvements. And we prepare you so well that these 70% of the marks are not going anywhere. Plus, of course, the other topics like organizational leadership, patient safety, or healthcare population, etc. They are important and they also carry some weightage, but they are not so difficult. So I'm purely talking from exams perspective. And this was a performance and process improvement. Here you learn how to do the projects, how to conduct the trainings, how to ensure that staff is trained, what is the importance of training, Kirkpatrick model, how do you evaluate the training? How do you evaluate the training? Generally on four bases. First is how the people are reacting in the classroom. Then second is, have they learned whatever has been taught to them? You can do this, you can check this by conducting a test or an exam. And after that, you have to watch their behavior. Has the behavior changed? And the fourth and most important thing is, are you getting the desired results? So that's what is about Kirkpatrick model. So train the people, evaluate your training effectiveness, etc. That's what is again covered in or as part of the role of a quality professional. Then also population health and care transitions. It's very important now, given the pandemic. These topics have been included in the quality, and if you are able to reduce the cost of healthcare for the government, because most of the countries, government is mainly responsible for healthcare. And by reducing the burden on the healthcare, you can always reduce the burden, financial burden on the government. So how to do that? And then healthcare data analytics. Here you learn lots of statistics, basic statistics, mean, median, mode, the different structures, supplier, process, output, customer, SIPOC, which we call it as structure, process, outcome, and experience measures. So how to create measures. And we'll also learn how to, not today, because I'm planning to take you through data analytics. We'll see how to, measure everything. And you cannot improve if you cannot measure. So today we'll talk about that. Then we also, briefly we'll touch upon the measurement and analysis part, some analytical tools I'll be discussing, and I'll show you, if time permits, I will show you some projects done in the hospitals. Then the fifth lesson is about patient safety, where around 18 questions are there, and usually no one fails in this section. And quality review and accountability, it is about maintaining the documentation so that you can get if there's a pay for performance announced by the government, then in that case you are able to get all. So now, so that was about I'll also pull out my there's a book called SK Solutions book. So we questions, it's good enough. It's equivalent to going through the book. So, so the idea is that we will provide you that, and apart from that, more than important, that explanation and the notes, and also we provide you the videos as well of the important videos, the tools and techniques, everything. So we prepare you for the CPHQ course that not only you will pass the examination, but after that you can start guiding others also, like how to pass the examination. Most of our attendees, they generally refer their friends. So thanks for joining in, and now let me take you through. Now, up to you. Let us make an agenda which works for you. Today, I'll not go into the organizational leadership, etc. Although it's also an interesting topic, but today we have chosen data analytics. But by the way, if you are interested in some of the videos related to leadership, one of the video I'll recommend, which is also there on the YouTube, and I have made, is about 5 levels of leadership. And these are the different 5 levels of leadership by John Maxwell. So John Maxwell's 5 levels of leadership. I will leave it to you to see that video. You can watch that. I'm not going to talk about leadership too much, but let me jump directly into the process improvement part and also the data analytics part. So the data analytics and process improvement, they go hand in hand. And some of the very, very popular techniques used in healthcare are Lean, Six Sigma, PDSA. Today, I will touch upon a little bit on Lean. I'll touch upon a little bit of Six Sigma. And I'll show you a Six Sigma project also while learning about the the data analytics part. In CPHQ, you don't have to really master the whole methodology. You don't have to become a PDSA expert, or don't have to become a Lean expert. You don't have to become a Six Sigma expert. To become a Six Sigma expert, you have to attend our another training, which is Green Belt or Black Belt. And many of the people in your region, they have attended our training programs, and we are quite popular for the Anexas is quite popular, especially our European headquarters. They are very popular in certification business of Lean and Six Sigma, Green Belt, Black Belt, etc. Our Australian like Anexas Australia is responsible for the certification in the Australian region. Those who are attended, I don't know, today is not the time for the Australians, but if you are watching this video, we have a presence in Melbourne also, and we conduct regular training programs of Green Belt, Black Belt for hospitals, healthcares, artificial intelligence, and data science for healthcare. Please watch 1 2-hour video. My team will put that link here. Please watch this 2-hour video on artificial intelligence and machine learning introduction for healthcare professionals. I've tried to explain the basic algorithms which are used in AI and ML, and that will give you a little idea of what's going around. Sometimes you might be confused with these jargons of AI, machine learning, deep learning, and random forests and all that stuff. So this will actually give you some good knowledge. Okay, let us jump to the Lean part. So a typical hospital environment has got high volume, high variety, high variability, high speed, high stress, high turnover. And excuse me for my throat today. Usually I'm more energetic, but today, due to some, I'm under the weather today. So I need a doctor. By the way, my wife is a doctor, so happens. Sometimes I'm the patient. Okay, so see, typically every hospital, there are service breakdowns, wasteful processes, and medical errors. So in this module, I'm going to talk about wasteful processes, and typically lean is about war on waste, identifying the waste in our systems. Now, this waste is not the one which we throw in the dustbin, but it is the waste which is present in our processes. Now, we are not aware of it. It is wasting our money, it is wasting our time, which is very, very important. And try to develop an eye to identify the waste in your system. How to do that? You can do Gemba. Gemba means go to the field, go to the place of action, and observe what are the types of waste. There are 7 types of waste. Very briefly, I'll just talk about them: waste of intelligence, waste of rework, defects, errors, waste of waiting, inventory, motion, transportation, overproduction, overprocessing. Now, this is mostly generally when we conduct the introduction to CPHQ, we increase our speed because this is more like giving you an overview. Now, we are not going to the details of any topic. We are giving you the bigger picture of many topics. Of course, we'll be going a little deeper into the data analytics part for some time. And then, of course, we'll try to give you lots of other topics, knowledge of a lot of other topics. So when you are identifying the muda means the waste. Waste. What is waste? What is the definition of waste? Any step for which the customer is not willing to pay for is a waste. So you may think it is required, this particular work, this particular step is required, but in a process map, if you find that the customer is not willing to pay for that step, it is designated as a waste, which is known as a muda in Japanese. To remember those 7 or 8 mudas, you can use ISWIMTOO, I swim to. Or you can also use downtime. There's another, the same abbreviation is downtime. Or you can rearrange these words into Tim Woods. So, left to you, whatever you choose, you can remember those 8 wastes, because these 8 wastes are very much present in our organization. We are not aware of it. And try to identify them and you will reap huge benefits. So when you are looking at some of the obvious wastes, which are very much, can be seen by naked eye or you can realize. So you can always try to work on them. But a lot of waste is not seen. It is hidden, like overtime, overstaffing, insurance reimbursements. They are all burden on the exchequer, on the government, right? Subsidies. So just to understand what is the basic definition of a waste. So the basic definition of a waste is anything which the customer. So if you were to tell me, if you were to ask me, so what is the definition of a waste? I'll give you the 3 conditions. If any of these 3 conditions is not satisfied, then that step, that process step becomes the waste. That activity becomes the waste. So the patient or the government, like basically customer should be willing to pay for it. Should be willing to pay for it. For that step. Yeah. If willing, that means it is value added. It is value added. And if the customer is not willing to pay, then it is non-value added. The second is, it should be done right the first time. Done right first time means if you are doing something again after committing a mistake, that means when you committed the mistake, you wasted time, money, resources of the organization. So it should be done right the first time. This is one of the important criteria of branding any step as a value added. And if it is not done right the first time, if it is done second time, third time, after committing a mistake, anything starting with review, rework is a waste, because you wasted the time, while you committed the mistake. So do it right the first time. And then also it should bring to designate a process step as a value added. It should bring the inputs closer to the output, or bring it to finish to the output. So let us take an example. So you can see that walk to the OPD, registration. These are all, see, as a patient, I'm not willing to pay for registration, walking to lab. First, you have to think about what is the value add from customer's perspective. Now, as a patient, let's say I'm the customer, as a patient, I'm interested in knowing my health status. That is the value I'm looking at. I'm not, see, the output, that whatever product or the deliverable which we are getting out of my process, we think sometimes that is the value. It is not the value. It is giving you the value. It is providing you the value. So the test itself is not the real value. Actually, the information which I'm getting from the test, that is of value. So to create that value, there are lots of steps I'm doing, like waiting, registration. The registration is not going to tell me about my status. So they are all non-value added activities. Now, some people might object to that. This is to get the testing done, you need to register. Well, that's your process. There are some labs, and there would be labs where you don't have to register. You can just go and get the blood test done and get the results immediately. So we are looking at that, what is value added and what is non-value added. So please remember and think from customer's perspective, not from your perspective. Then the wasteful hospital, example of a hospital where the waste of intelligence is evident. 80% of the nurse calls are housekeeping in nature, means people are unnecessarily wasting the time of the nurses by asking about the works to be done related to housekeeping, like my pillow cover is dirty, my bed sheet is not okay, etc., etc. So this is wastage of time of the nurse. And nurse will forget to give you the medicine if you try to indulge the nurse into some other activities. It is waste of intelligence. Another waste of intelligence is surgeon is waiting for the operation theater to get ready. That is again waste of intelligence. Able to double the cardiology lab capacity from 8 to 16. Now the whole case is written here. I'm not going to talk much about it right now. The idea is to give you the bigger picture. So here, reduce. You were able to reduce diagnosis to exam time from 2,000 minutes to 64 minutes. Before, like if I just let me talk about this. So patients earlier had to wait up to 6 days between the cardiologist exam conducted in the doctor's office and the treadmill exam conducted in the diagnostics lab. So it was a waiting period of 6 days. Typically, the whole process would take 6 days. So now, after observing the flow of the patients from the cardiologist's office to the diagnostic lab, 2 physicians decided to see the patients in the diagnostic lab. Now, patients make appointment to see the cardiologist there. And the daily schedule for the diagnostic exams was changed, so patients could get both exams done on the same day. So drastically, you could reduce the time. So lots of examples are there, but just identifying the waste in the system and creating and focusing on value only you can achieve great results. So typical patient flow looks like this, and we identify which is value added, which is not value added. So value added, non-value added. So this step is value added, okay, value added. This step is non-value added, that is waiting. This step is value added, okay. This step is okay, this is also value added. This is non-value added, any delay is not non-value added. So you try to classify all the steps into value added and non-value added, and try to reduce the non-value added activities as much as possible. Today, as I promised, that I'll be focusing more on data. So let me quickly rush through some of the examples of waste. So unnecessary process, motion, unnecessary waiting, unnecessary transportation, errors. They are all examples of waste. A person who's underutilized is a waste. An equipment which is underutilized is a waste. Even overutilized is also waste. Cost of 5 minute MD walk is costs money. And similarly, if you look at this, you can say that the nurse cost per hour, if it's $50 per hour, the cost of one trip is $5, and it really costs even a single nurse to move around. And just think of a hospital which has got 200 nurses multiplied by 365 days. You can imagine the kind of wastage we are talking about. Okay, so try to locate or co-locate the equipment which are often used. So rather than going from ground floor to second floor every time, bring them down to same floor after observing a spaghetti diagram. Spaghetti diagram is a visual map of how the people are moving in our, let's say, I make it on the ground floor near the reception area, and I have got reception here and some, let's say, some clinics here, OPD, yeah. So if I observe and I find that most of the people, they are coming here, then they are coming here. So you will get a spaghetti diagram. Spaghetti diagram is, it's like a movement of the people. So you can see that maximum traffic is coming from here to here. So why not I make a reception somewhere here, and this particular booth I can, or table, or the station, or the clinic, whatever it is, I can be shifting to near the reception. So that I will reduce a lot of waste of motion in the organization. Similarly, you can use visual controls to reduce the errors and mistakes by using certain visual controls. And similarly, using visual controls, we can improve our efficiency as well. Hospital should be a visual hospital. People should not waste time and money. Time is money, right? So they should not waste their time by asking or seeking directions. So I try to have a visual hospital. There's a concept called mistake proofing, also known as pokayoke. Pokayoke in Japanese means mistake proofing, or it also means a fool proofing. Even a foolish person cannot commit a mistake. Like a foolish person like me who tries to cook the rice, he will always forget. So the rice cooker automatically gets switched off. Even a foolish person like me cannot, burn the rice. So similarly, develop a system so that you are not allowed to commit a mistake. So some of the examples, some of the machines can't be operated beyond the safe, normal, safe or maximum levels, or and some of the medicines cannot be entered beyond the in the abnormal values range. Like, so normal range is this, so this, something like this will be rejected. Similarly, oxygen cannot be connected to nitrogen cylinders because of the connectors. The shape of the connectors is totally different. Other examples of pokayoke would be fixed number of packages during the surgery, complete catheter kits for insertion, etc. So these are all examples of pokayoke. So I briefly covered about lean, what is lean, or and let me now jump to the data parts. So there'll be quite a good number of questions, 14, 15, 44, 50, 40 to 50 questions on data analytics. Sometimes it's a mix of data analytics and process improvement. So altogether, they comprise around 70 questions. So very, very important to learn those chapters. Now, do you agree that some data can be measured and some cannot be measured? So, Aldisin is asking after the CPHQ course how to take the exam. So once you join our CPHQ course, I will guide you fully how to take the examination. You can appear for the examination sitting at home as well. Okay, so do you agree that some of the data can be measured, something can be measured, something cannot be measured? Some of you are telling yes, some of you are telling no. Okay, so let me tell you, you cannot improve if you cannot measure. And the second part is you can measure everything. Yeah. Now, how to measure everything? Let me tell you. So there are two types of data. What are the two types of data? Continuous data and attributed data. Continuous data is something which can be represented on a number line. It can be represented, it can take decimal places, it can take, it always has a unit, something like this, procurement time, waiting time of patient. It could have 16.2 minutes waiting time for the patient. Similarly, you have got height, weight, blood pressure. All these are examples of continuous data. Then you have got attribute data. Attribute data is something. So one of you telling you're planning to join CPHQ. Very good. Welcome. Okay, great. And when you join my session, my speed is very low, and generally, we usually explain everything with a lot of examples. Right now, it's like a little fast-paced, explanation of lots of tools in a short time. So, have you, Leila, have you attended our training session before? So, have you attended our so some of you are asking questions. Yeah. So, those who have attended our sessions, you can just connect with us and you can just join us. I think there's almost, depends on when did you do it, but you can join it. Just connect with one of our persons and you should be able to get it. And May is telling first time. So first time you'll have to register. Yeah. So once you register with us, you can attend the session multiple times. After 2 years or so. I'm not foreseeing that you'll be attending after 2 years. You can, of course. Sometimes people say, well, I did not appear for the exam this year, but I finally got an opportunity to appear for the exam after 2 years. Most welcome. You can again revise. Again, you can join our session for revision. No problems. Okay, so now answer your... just can you please... by the way, I'm just speaking to Leila here, because you have attended our sessions before 15th, 2023. So there have been some changes. They're not major changes. They're like, say 10-20% of the things have changed. So we have updated our training material, and most welcome. You can join, or you can. We will send you the updated training material as well, and all the some of the recordings as well. So I think you will be up to the mark. Okay, great. Yeah. So coming back. So there are two types of data: continuous data. So I told you, continuous data, you have got, it is represented on a number line always. number line from minus infinity to plus infinity. I hope I'm not using too many jargons. Yeah. Any number, any point on that line can be represented as a number, as a continuous. That is why it is known as continuous data. Then you have a discrete data which falls in continuous as well as attribute, but attribute definitely is discrete always. So discrete could be even continuous as well. Discrete means like 1 or 2 or 3 or 4 or 5. There's no decimal place. Now, typically, when you are expressing attributes, how will you measure attributes? Attributes are measured in categories, and generally in categories we count. How will I express this in number? I generally count. So when you count, we are talking in terms of attribute data. And also a thumb rule is that for continuous data, you have to collect 30 to 50 samples. And for attribute data, you have to collect around 200 to 1,100. 1,100 is the ideal size, but always you will not get 1,100, obviously. So you can just live with maybe 200, 300, 150 or so. Great. Now let us look at the analysis part. So what I will do, I'll take you through some tools and techniques, which today I don't think I have got time for taking you through FME, failure modes and effects analysis, which is also a very powerful tool. But you can watch my video and also download the template of the FME, and you can do it yourself. Just watch the video and you can do it. It's so easy. So my team will put one link here, which is about FME. And always, please collect those links. They are very, very useful for you. You'll learn a lot. But find some time, to further study after this training also. Just sit for a while, around maybe 1 or 2 hours, and you can always gain a lot of knowledge. So as I was telling, there are 2 types of data. I've got some videos also, like the one I can show you. And these videos are available on our YouTube channel. So you can always subscribe to our YouTube channel. So here I'm talking about the 2 types of data. There are 2 types of data, continuous data and attribute data. Continuous data can be represented on a number line. It can have a decimal place. It can also have a unit. Say, for example, age, height. Age is 52.5 years. That's my age. Height, maybe 180.1 centimeters. Cycle time of a process, 3.5 hours. Or procurement time in an organization, 120.3 days. These are all continuous data because they all have a possibility of a decimal, means they can be expressed in decimal points, and also they all have a unit. Now let us talk about attribute data. Attribute data can be expressed in categories, and categories can be counted. So just to tell you that, a good way of putting a measure on an attribute data is first try to identify the categories of that attribute. And if you can't think of anything, sometimes we can't think of anything, then just create 2 categories: presence or absence of that attribute, whatever attribute you're looking at. So can you tell me something in our hospital, generally, what is difficult to measure? Anything. Give me anything and we'll try to put a measure there. Okay, Abdullah is asking, do we receive the certificate? Yes, you can receive the certificate for these 2 hours as well. You might be needing it for fulfilling the PDUs, etc. So yes, you will get the certificate. Because of course, we are conducting this training program not in a particular country, it's like for multiple countries. So we don't give any specific government issued certificate, obviously. But this certificate is also whatever, after you attend this session, you'll get certificate. There's an admin fees for that, a little bit what you'll be paying for a lunch in your city, approximately that much, to take care of all the people who are making it happen, bringing all the certificates. It's not an easy task. And there's a team behind it, and I'm sure you'll be willing to invest that much for the certificate if you want. Okay, coming back. So no one told me anything which they want, they find it difficult. So we have got Pawan Kumar who wants to join the CPHQ session, and also one more person I have not recognized. His name is not there. But yeah. So coming back now, let's look. Oh, some people have written. So Rabia is talking about satisfaction. So anything. Some people say satisfaction. Okay. So satisfaction. Now, how will I measure the satisfaction? So there are 2-3 ways of measuring. I can use Likert scale, like highly dissatisfied, neutral, satisfied, and highly satisfied. Or I can create those categories. I can use a binary category also, now to make the thing simpler. Satisfied or dissatisfied. So happy or dissatisfied. Let's say. I'm not interested in measuring neutrals. And if I give a choice of being neutral, more maximum people just go to neutral. So I'm not giving. Either you're happy or not happy, satisfied or not satisfied. And then I count, and out of 100 customers, or out of 100 patients, 80 say I'm happy with your services and 20 are unhappy. So proportion becomes 0.80 and 0.20. So proportion means portion out of 1. So if the circle was 1, what will be the portion belonging to satisfaction? And be careful then when you are talking about satisfaction as an attribute data. Always remember, you find it very difficult to measure anything which is attribute in nature. So when you are saying satisfaction, we have created those categories of satisfaction and dissatisfaction. And now, in a fair way, I can estimate the satisfaction of all of my patients. And that's the beauty of it. In my Greenbelt classroom, we do an exercise. Sometimes let's say, I'll just give an example. We collect the heights of people, and we plot it on the normal, like the histogram, and we identify the average and the standard deviation, and we can predict the range of the heights of people all over the world. Just 30 samples. We are talking about when I'm working with the continuous data, just 30 samples is good enough. But for attribute data, it takes a little time. So how do I measure the attribute data? So one way of measuring is that I can say percentage also. If you want, I can write the percentage. Proportion means out of 1 and percentage means out of 100. So I can fairly closely estimate the satisfaction of my patients by saying that 80% of my patients are happy. Now, you don't have to really go and collect samples from each and every patient, even 200, 300 samples. Suppose you are at 80% with, let's say your sample size was 100 and your satisfaction index was 80. If your sample size becomes 1,000 also, your satisfaction index won't become like from 80 to suddenly 95 or maybe 50 or 40. No, it's not going to happen. That's the way we are. That's the way the nature is, right? So we just saw how to measure everything. It also, let me play the video, which is talking about, I think, one of the difficult things to measure is happiness. So here we go. Same thing.
Say, for example, if you want to measure happiness, so
easiest way to measure any attribute data is to create a category, and if possible you can create a binary category. A presence or absence of that attribute can be one of the simplest categories. So if I take the example of happiness, two categories I can create: happy, unhappy. So if I want to increase the happiness in the employees in the organization, then I can always count how many employees are happy. Let's say 60 employees are happy and 40 employees are unhappy. I can express this as proportion. That means proportion of happy employees in my organization is 0.6 and proportion of unhappy employees is 0.4. And it can also be expressed as percentage. Now this proportion or percentage, they don't have a unit. And a count like 60 employees, I can't have 60.1 employees who are happy. So the count will not have any decimal point. So this is what continuous data and attribute data is. It is very important to know the difference between continuous and attribute data. And it is very important to understand what is continuous data and what is attribute data. So there are other types of data also. I've just mentioned, as I said, it's a foundational course. So there are other scales also, like interval scales, ratio scales. We already saw the proportional scales. And most of us are familiar with them, but when it comes to the analytics part, sometimes we lose the track and we don't know how to analyze. So there are certain rules. When you are dealing with continuous data, then you will use histogram. Histograms means you can plot a histogram because it's continuous data. The x-axis is divided on a continuous scale. Okay, so that is why. And histogram tells you where is the center of the process. So you can see that center of the process somewhere here, somewhere where the tallest frequency, the highest frequencies are occurring in that particular age group, right? 20 is appearing most of the time. The histogram can be only done on continuous data. Remember that. Age is a continuous data. So I'm making a histogram. Then comes bar chart. Bar chart can be done for attribute data. You cannot do a histogram because every bar represents one category. I hope you are getting. Feel free to ask and if you have any questions. And then there is something called as box plot. If you want to know the details of box plot, please watch the whole video, which will be coming in the chat box. But very, very bigger picture, I can tell you. Box plot divides the data into 4 equal parts. So first you have to arrange the data in sequential order, and then first find the midpoint, which is the median. And then if you are dividing the whole data into quartiles, tiling the data into quarters, you get quartiles. Then you can get just decile or percentile, depends on within how many parts you are dividing your data, dividing the whole range of the data. Okay, so this particular tool, box plot, is for attribute data. Then we have got combinations. By the way, before I go, let me also talk about a little bit of, these, like for example, these types of charts. Pareto charts are good for attribute data. But when I have got combination of continuous and attribute data, like age is related to the age of employees and experience of the employees, are they correlated? So these are both continuous data. So I'll be using scatter diagram. I'll be using some other tools. So let me talk about it. The reason we are learning about the types of data is I can know when to use which tool. You cannot use every tool anywhere. So it has to be specific. So how to choose the tool. This is what maybe briefly I'll mention here. Pareto charts or bar chart, if your attribute is, it is very important to know the difference between continuous and attribute data. And it is very important to understand what is continuous data and what is attribute data, because the tools which you are going to use in the measure and analyze phases, they depend on what type of data you are dealing with. If you are dealing with continuous data, then you might use histograms. If you are dealing with attribute data, you may use pie chart or Pareto charts or bar charts. If you are dealing with combination of continuous and attribute, like in inferential statistics, then you may be using box plots and scatter plots and regression, ANOVA, chi-square, etc. So the tool usage depends on the type of data you are dealing with. So it is very important to understand the types of data.
So these videos explain in detail all the different tools and techniques. And these videos, the tool-based videos are very much part of your learning management system when you join us. And apart from giving the assurance that you'll be passing the examination, and we are, it's like pure based on your own performance, you will pass the examination. We are just going to, sort of, we can say, guide you. That's it, motivate you. But beyond that, you can, definitely pass the examination. Now, let us go back to our types of data. And why are we learning that? So I've got two types of data, continuous and attribute. Now, when I'm just interested in showing or displaying the continuous data only, I'm displaying. I'm not trying to find the root cause. I'm not trying to validate the root cause. That will happen a little later. But if I am just looking at, I've collected some data, let's say waiting time for the patient or patient discharge time. Patient discharge time, so when you are looking at the type of data, if I am, let's say, let me show you. Let me, we have done this project, and some of you have already attended our Greenbelt sessions. There we have this case study also. If you remember, in a hospital to reduce the patient discharge time. So let us try to do an improvement projects, and let us try to learn these tools and techniques. Now, the details of the step-by-step approach right now for the foundational training, you don't have to really go through that. I'll just show you. So let's say whenever I'm dealing with continuous data, this is continuous data, patient number and baseline discharge time. So I can make a histogram. Histogram means historical graph. I have this data is historical data, means I've collected the data, I've got the data with me. I'm now interested in presenting it. So I can always do a histogram. Nowadays, softwares are there. We teach you the softwares. You can use the softwares. Mostly CPHQ doesn't, test you in any expertise of software. See, this is the software. The software doesn't mean like some coding, etc. This is the one I'm using. It's just like an Excel sheet. The Excel sheet is also capable of giving those analysis, but it's a little difficult. So there are lots of better tools available in the market. Okay, so I'm just using the one of the tools called Minitab. You can see that yeah. Baseline performance. Yeah. So this is how our patient discharge time looks like today. Most of the processes, they follow normal distribution given by Carl Friedrich Gauss, one scientist. In 17th and 18th century, he studied lots of repetitive processes, and he found that all the repetitive processes, they are trying to hit a target, but they can't hit the target every time. There will be like a little bit left and right side. And then that gave rise to
control charts. So later on, and before that, histogram. So histogram means, historically, trying to make a frequency chart, how many times a particular within one range it's appearing. And you will find typically there will be a center, somewhere in the center, and the whole the readings will be spread out. And you will notice that it is about normal distribution. So our patient discharge time is normally distributed. There's one way of even knowing that it's normally distributed or not by looking at the p-value, but I'll not go into that right now. The p-value, if it is more than 0.05, the data are normal. Otherwise, it is not normal. So this data appears to be normal because p-value is more than 0.05. This data is normal. And this also tells you although the average of the sample is 300 minutes. Means on an average, our patients are discharged within 300 minutes or around 300 minutes. Sometimes it goes up to 360 also. Sometimes it goes up to 240 also. But very few times it goes to those levels. But most of the time I'm around 300. But that 300 is if you see, mean is 303. But 303 is the mean of this particular sample. What about the whole population? The population mean is also 303. Well, I can't say, but yeah, it will be somewhere closer to 303, plus minus something. What is that plus minus something? It is 2 times standard deviation. See, those who are aware of those statistical part, I'm just trying to refer to that. But let me not make assumptions. Let's assume in the beginning, most of you have not attended any quality-related training program. So I'll not talk too much about something which requires a little bit of explanation. In our program, when you're joining our CPHQ training, so when you join our CPHQ training or any of our training which is related to statistical part, you will get lots of examples and an explanation going deep into that particular topic. So for the time being, just understand that Mr. Gauss, he found that most of the times the repetitive processes, they follow normal distribution. It has got an average and the curve appears to touch. Now, I'm talking about appears to touch the x-axis. It never touches. Actually, it goes to the infinity. But 99% of the total population, 99.73% of the total population lies within plus minus 3 times the standard deviation. Plus minus 3 times the standard deviation. Now you already know the standard deviation. It's very easy. Just put the data into Excel and ask Excel is equal to STDEV, standard deviation. You'll get it. Even here also you got it, not just now. In few clicks, you got average is 303 and standard deviation is 25. Now average of the mean of the sample definitely is 303. But what about the population? The population mean is between 289 to 317. We call it as 95% band, confidence band of mean. Means I know if I had all the patients who have been discharged or who would be discharged in the future, the mean of the whole population would be lying within that range. Yeah. And obviously the larger samples and more larger sample size, the uncertainty band will reduce a little bit, not much. After 30, it doesn't matter. So 30 is optimal size for our continuous data. Please remember that. Okay, by the way, I have also given you the recording of this program. You can always rewind it. You can always rewind it and look at the whole training once more. Okay. So now let us go back to our a normal distribution. So plus minus 3 times standard deviation. So some of you are asking that I am in a very small clinic. Will it help? Of course, it will help. There are two things. You are not going to remain in the small clinic every time for forever. So you would like to, graduate. You would like to further progress. And Lean and Six Sigma or CPHQ or data analysis or data science, machine learning. These are the certifications which are going to be very, very helpful for you. Yeah. Okay. Now, Mr. Gauss, he found that plus minus 3 times the standard deviation lies the 99% of the values. So, if I know the average and the standard deviation, I can predict those values, isn't it? So, if I take the same example, what is the average? 303. Standard deviation is 25. For the sake of calculations, let me write X bar is 300. And standard deviation sample standard deviation is denoted by S. So sample standard deviation was 25. So now let us try to fill this in our hospital. How many minutes it takes for our patient to get discharged? On an average, it is 300, obviously. Plus 1 time standard deviation. So standard deviation is 25, 1 time standard deviation is 325. Plus 3 times standard deviation is how much? 330. Sorry, 25, it will be 50, 350. Yeah. 325, 350, and this will be 375. Right? I hope you got it. And similarly, here it will be 275, 250, and 225. So I can say that maximum patient, 99% of our patients are waiting for, they have to wait after getting the discharge process takes 220 minutes, 25 minutes to 375 minutes. Please ask me if you have not understood, or please watch the video again. Don't ask me again. You can watch the video again. Now let me rename this. This is known as lower control limit and this is known as upper control limit, LCL and UCL. Means 99% of the time my process will be operating within this range. That doesn't mean that process is good, like process is satisfying the customer. Process is obviously good because most of the readings you are getting within plus minus 3 times standard deviation sigma limits means there is no special things happening. There is no, you are able to, your process is stable. In a way, your process is stable. It is under control. We say it is under control. So if you are behaving with a lower and upper control limit, we also call this as voice of process. Your process is telling, as if your process is telling that I am going to behave within this. When the patient comes to my hospital and he's about to get discharged, typically it will take 225 to 375 minutes. Not less than 2025, not more than 375. That's also a good estimation. And again, as being a CPHQ professional, you can make those estimations. Then comes, we can also, expand it on a control chart here. We can just take it. So this is my lower control limit. And this is my upper control limit, LCL, and this is about UCL. Lower control limit is 225 and upper control limit is 375. So if I start plotting the data of waiting time of the patients. Yeah. The process appears to be under control. Why? It's not going beyond the control limits. The control limits, who decided? The control limits are decided by the process themselves. Please remember, the control limits are not set by the customers. Customers set the specification limit. We'll come to that. But right now we are just talking about the control limits. So the control limits, 225 to 375 is our, okay, let me write it properly. 225. So 225 to 375 are our control limits. Maximum patients will get discharged within this time. So I can make certain plans accordingly. So process is under control, but is it satisfying the customer? Of course, no. Voice of customer is, let me put voice of customer here also. Voice of customer is go beyond 300 minutes. So when you say you should not go beyond 300 minutes and your average is 300, you will always go. 50% of the time you'll be going beyond 300, isn't it? Because the area beyond the center on the right or left side is half, like 50%. So if you're targeting to, see, I just changed this. Let's say you're trying to complete a job. Let's say you're targeting 300. Let's say 300 minutes of patient discharge time. If your target is 300, you will end up, 50% of the times you'll be above that. Not necessarily the targets set by the customers will be 225 or 375 within that range. They could be more also. Say, for example, let me tell you that patient discharge time today is 225 minutes to 375 minutes. And the ministry or the customer or maybe the senior management say patients should not wait beyond 120 minutes. Okay. This is the voice of customer. So please understand, this is the voice of process. Voice of process is decided by the process itself. The way it behaves, the way you have trained the people, the way you run your equipment, all these things will decide about your control limits. Now, what is our goal? To bring the whole process shift. The whole process should shift. There's a change in the DNA of the process. And this shift is brought about by DMAC, Define, Measure, Analyze, Improve, and Control. DMAC or PDSA. Okay. Or any other. There are so many methodologies. Lean. You can use benchmarking, a lot of other tools you can use. And you can always take up an improvement project. So I hope you understood what is the control limit and what is the specification limit, that there is a difference between the two. Also, if I think still have time, so let me also talk about, let's take this example. Now, one patient waited for 230 minutes, another patient waited for 240 minutes. What is the reason for that? If I ask you, give me the reason. Why 230, 240? You can also write your suggestions. Now, a statistician will say, I think you are all experts. Yeah, because it appears you are all experts. So the thing is, a statistician will say movement between 230 to 240 is not, don't assign a cause to it. Don't look for reason for that. It is the natural variation of your process. The natural variation. Natural variation comes from cause and effect diagram or fishbone diagram. So if you are looking at patient discharge time, what could be possible reasons? What could be possible reasons? These reasons we call them as X factors, and the the measure which we are trying to reduce or improve is known as Y. And we call it Y is function of X. Means instead of focusing on Y, let us focus on the X factors. Automatically the Y will be taken care of. So here I'm looking at patient discharge time. Can you give me one or two reasons why, what could be the reasons? And the question again, coming back to that question, if my boss asks me, yesterday it took 230 minutes to discharge a patient and today is taking 240 minutes. Why? So the straight answer would be, it is due to natural variation. Don't look for the cause. Yeah, so Khulud is written here, okay, complications, okay, infection. And then when I give you around 20-30 minutes to write a cause and effect diagram, we can come out with a very, very nice, elaborated cause and effect diagram. Like the way the same project, if I continue. So there's a method of man, machine, material method, measurement, man-related causes, machine-related causes, material-related causes, method, MMM, man, machine, material, method, measurement, and environment. Environment can be also Mother Nature. You can use that as well, but right now, for the time being, we are using environment. So I have got to brainstorm on all the possible causes. All the possible causes, again, with the help of the team, using brainstorming techniques. And I can make a cause and effect diagram. You can do this as well in your laptops. You can download this Minitab if you are interested, from minitab.com. You can play around with that. It gets expired after 1 month. Just be aware of that part as well. Yeah, but first, passing the CPHQ, you don't have to learn the software. I'm just using it for your demonstration because right now I don't have much time. I have to give you lots of tools and techniques. So we have learned histogram, we have learned control charts. Now we are learning common cause and special cause variation. Okay. So if I go and again go back to the same question, why 230 and 240? The reason will be lots of causes are acting on my system. So if I list down multiple causes, which I have listed down here, lots of causes are acting on my system and producing this variation. So there are multiple X factors which are impacting my Y. And every factor has got some variation. So overall, I will get some variation, but I'm not looking at small term gains. Not high, you can do that. Obviously, you can use your logic intuition, but unfortunately, the data indicates that human beings are emotional. They don't talk about logic. They're not logical. They're not rational. They're emotional. So there are limitations of human beings. But these tools and techniques which you are using, like cause and effect diagram, later on Pareto analysis, scatter plots, etc., they help you to bring in the objectivity in your analysis. Yeah, so now I've got my cause and effect diagram, and the statistical answer would be, well, all the causes are acting on my system and producing this variation. So just relax. Otherwise, what happens? People are, 230, 240. They keep searching reasons, unnecessarily over reaction. Now, let me also ask you another question. The one fine day, one patient took 500 minutes. Very, very high. This usually doesn't happen, but it happened. Then we call this as assignable cause. Assignable cause. I can assign a reason there. Specifically, someone asked me why this patient took 500. Oh, there was he's waiting for the relatives. So I have got an assignable or special cause reason. So process is under control if there are no points going beyond the control limits. But process under control doesn't mean it is satisfying the customer. To satisfy the customer, the process should be under control and it should be also within the specification limits of the customers. I hope you got this point. Okay, great. Now comes, so any questions here? Anything, a control chart? What is again, one more, all the things with a day-to-day life example. I have put a video in YouTube. Later on, I'm not going to show you this whole video, but you can always watch this video in our YouTube channel. And please subscribe to the YouTube channel. You will get all the explanations. So here I have taken an example of going to office.
45 minutes. So you can expect me to travel to my office every day between 15 to 45.
So you can always watch this video, okay? It is giving a simple example of going to office. Average time is 30 minutes. And then what is common cause, what is special cause? I've already explained to you, but if you want to watch it in a different setup, why not? With a different example, you can always see that. Great. Any other questions? Okay, I think if there are no questions, then I will proceed to further analysis. See, we should not trust the cause and effect diagram. So many causes are there. You can do a Pareto analysis. Pareto means Wilfredo Pareto was an Italian economist who found that 80% of the money or the wealth in Italy was with 20% of the people. He called this as 80-20 rule, and I'm sure many of you have already heard of 80-20 or Pareto's principle. 80% of your, patients are from, let's say there are 100 possible diseases. Only 20 diseases will be responsible for 80% of the patients. Suppose there are 20 diseases you are treating. So out of this 20% of 20 is 4. So 4 diseases are the most occurring diseases in the patients. So the 80-20 rule is applicable everywhere, and that's why very popular in problem solving. So I cannot attack all the causes. So let me take the number. Which causes are coming more frequently again and again? Why are the reasons for delay? When I'm collecting the data, some reasons are coming again and again. So can I do something about it? First, let me arrange them. How many times each reason is coming? I'll arrange them in descending order. Okay, and ascending and descending order means I'll put all the causes on descending order. So cause number A, cause number B, cause number C. And there could be a basis right now. For the time being, I'm just putting, the like drawing the picture. But if you want to see, let me show you that as well. So these are the reasons for delay. Now, which reasons are occurring most? So the Pareto chart, what it does, it brings the highest frequency bar towards the left side. And you can easily make a Pareto. So here, it's just chosen to make a Pareto here. So reporting not accurate because of that inaccuracy, a lot of mistakes are happening. It leads to rework, and that is where the patient gets delayed. Maybe that is one of the reasons. Staff is not available, a pharmacy delay, and discharge summary delay. There's delay in the writing of discharge summary, and that is why. So they have listed down which reasons are occurring more frequently, and they will work on it. The team will work on it. And as a quality professional, you have to manage the teams. You have to facilitate the teams. So you act like a servant leader. The hospital, the employees, the staff members, they're doing the projects. And you are removing the obstacles as they do the projects. You're removing the obstacles. You're more like a servant leader. You're like a leader, right? Okay, so now I have got the top 4-5 reasons. And well, if they have got top 4-5 reasons, I hope this was clear to you, the Pareto analysis, how it was done. Now, in the CPHQ examination, a histogram will be given to you, and you have to interpret. You have to answer some questions related to whatever histogram is showing. You will get a cause and effect diagram. You can get a Pareto analysis. You can get a scatter plots, etc. So you will be given a tool, and you have to answer these questions within 1.5 minutes. So that's not much time. So they will not give you lengthy questions. So as long as you understood this, now I've got my Pareto analysis. Okay, done. Well, then now let me further validate it. Further validate. Patient discharge time. People discharged. So patient discharge time, okay. Patient discharge time has got now, is it affected by the, let's say, discharge summary delay? So the analytical rule says, Dr. Deming used to say, in God we trust, rest others bring data. Means I'm not going to trust you unless you show me the data. So whenever you're trying to make a statement or assign a cause, better make it based on the data. And nowadays, all the tests are available, statistical tests, everything is very, very high powered tests are available. And when you join our CPHQ course, Green Belt, Black Belt, Data Science course, you will master those, hypothesis tests, etc. But for the time being, I'm just giving you the brief overview. And here it is Y and here it is X. This is continuous data and this is also continuous data, both. Like, for example, age and experience. So as the experience increases, age increases, right? Positive relation. Or there could be a negative relation, like something increases, like, for example, time taken to complete a job. If I just replace age with time taken to complete the job. Time taken to complete the job reduces as you gain experience. This is negative relation. Then you can also do regression equations. I'm not covering that part here, but just to give you an idea why we made how we can use it, the scatter plot. So I want to investigate, let's say, discharge summary time and discharge time, are they correlated? So what I will do, both are continuous data, isn't it? Both are continuous data. So discharge summary time and discharge time, both are continuous data. By the way, here, staff availability, available, not available, that is attribute data. Reporting accuracy, it is attribute data. I hope you remember in the beginning, one hour ago, I talked about it, right? So discharge time and discharge summary time, are they correlated? Now, how will I know? By using, of course, scatter plot. So let's do a scatter plot. Scatter plot. So discharge time and patient discharge time. Yeah, it is correlated. So if I start working on reducing the discharge summary delay, it will have a good impact on my discharge time. So that becomes my root cause, which is validated. Now, let us look at another one as well. Let's look at discharge summary delay versus pharmacy time. Or yeah, I think this is good. So discharge time versus pharmacy time. Is pharmacy impacting? Like, more the pharmacy time, more will be the discharge time. Are they correlated? So let us do. Pharmacy time we want, right? So let's see pharmacy time. It doesn't appear that they are related. Means my pharmacy time is not the root cause. So I'm doing a root cause analysis and I'm validating them. Yeah. Similarly, when I'm dealing with attribute data, I cannot deal with the scatter plot here. Like reporting accuracy, is it impacting my discharge time? Let us see. So which tool I will use? Reporting accuracy is attribute data and discharge time is continuous data. So I will use box plots. Let me draw this box plot here also. Let's say patient discharge time is what you are trying to reduce. And let's say department A, department B. Department A, the patient discharge time is very high. Department B, the patient discharge time is very low. That means departments do impact. See, we have to go and keep checking which X factor is having good impact. So here, looking at the graph, it appears that the department actually has an impact. Some departments, the patients are taking more time for discharging, and some patients are taking less time for discharging. Okay, so I think yeah. So this is how I can use a box plot. And if the data is like this, something like this, well, both the categories are same, A and B. You take any category, your fate is same. So here, discharge time, you're talking about any department, doesn't matter in this case, but in this department, A is better than B. So I've covered lots of data analytics today. I think good. For hypothesis test, I'll have to wait a little bit. It will take like 1 hour to explain the basics of hypothesis tests. Then you can easily do the hypothesis test. But there's not much time today for that. So just now you saw some of the basic rules. So these are the basic rules. So these are the topics: quality leadership, then which has strategic planning and stakeholder engagement. Then next topic, day two, we cover performance and improvement management. Sometimes we interchange the lesson, but once we cover the full lesson, then only we'll go to the next lessons. So lesson, yeah, the day two. Then we have lesson number 3, where we cover population health and data care transitions. Next, health data analytics. Next. So these are the code content which I already showed you: measurement and analysis. Next, and patient safety, quality review and accountability. Yeah. So with that, I think you would like to know. Would you like to know the fees as well? Do you have the fees as well? How about the fees? Do we? My team, I'll need guidance. Some people are asking for the fees. So see, we can give you some discounts, but I'm like, after the discount, the fee will be very low. But I can tell you, where are we right now? So usual fee is $600 plus $100. But for today, if you express your willingness, or tomorrow, if you express your willingness and you book the seat, you'll get it at a very, very lesser price. Okay. Please avail of this opportunity. And see you soon. Any question is there? A lot of things will come to you for free. CHQ certificate, a yellow belt as well, project completion certificate. Feel free to speak to my people and fill in the form which is given here, and you will join us soon. Go ahead, and I'm waiting for you to welcome. There are some a team also of co-trainers, so we keep conducting the training programs. And this batch is like, if you join this batch, you will be coming to my class. Of course, one assistant would be there as I conduct the session. So, but most of the time I'll be doing the session. Great. Thank you. Thanks a lot. Any questions? Any questions? Okay, great. So my team is there to answer some of your questions. And great. Thanks a lot. Thanks a lot for joining. And see you soon. Thank you. So I'll leave you with some of the videos. That's good. Under
Undergoing a CPHQ training is like keeping pace with the quality standards and advancements in the healthcare sector. The CPHQ certification is a credential that signifies both professional and academic achievement for those who are in healthcare. Certified professionals in healthcare quality, that is CPHQ, can be taken up by anyone who is in healthcare profession or wants to pursue a career in healthcare. Once you are a CPHQ certified, it will signify that you have the specific healthcare quality skill set and knowledge that can make a difference in improving outcomes across the healthcare sector. There is no eligibility requirement to sit in the CPHQ exam. The CPHQ exam consists of 125 multiple choice questions which are scored and 15 multiple choice questions that are not scored. You are allotted 3 hours to take the CPHQ exam. The score needed to pass the CPHQ exam varies each year based on the difficulty of the exam. On an average, you need to answer approximately 70 to 75% correct to pass the exam. We at Anexas have trained more than 3,000 CPHQ professionals, and we can also help you to write your exam successfully. Here are some few tips from us for exam preparation. First one, regarding time management. You don't have to study thick textbooks and 5 different test preparation materials to pass the exam. We provide you with all the material required. Using Pareto's 80-20 principle, we have segregated 20% of the most important material and we tell you to study that. Just read it and solve some mock exams, which of course we are going to provide you, and you are ready to appear for the exam. After attending our course, if you want to revise again, you can join our course once more without paying any online training fee. All the best for your exam.